insulin's present in the bloodstream, we cannot take the fat out of the cell to burn it, so we can't burn fat. So of course it's difficult to lose weight or maintain a healthy weight. The other reasons that it's not so great to have insulin floating around is that insulin causes damage inside the arteries. So imagine this is an artery. An artery is made of smooth muscle, and inside the artery is lined with cells. They're called endothelial cells. They're similar to the skin cells, which are called epithelial. Epi meaning on the outside, endo meaning on the inside. So endothelial cells. So they're very sensitive. And insulin inside the arteries causes damage inside the arteries. It can cause damage to the endothelial layer. So what happens when there's damage inside the artery, it's very similar to if I cut my hand or I have damage to my hand. So when I cut my hand, things happen automatically. So of course I might bleed, and then I naturally will have white blood cells kind of go to that area and munch the bacteria that could have been on the surface of the skin so it doesn't start to circulate around. And then I might have some inflammation, and my body will send messages to clot in this area so I don't bleed to death from a simple cut. And then I will send and manufacture new cells to fill and heal that cut, and I may form a scar. Same thing virtually happens inside the artery. So if there's something in the artery that's causing damage, like insulin can cause damage, like the cut on my hand. And so the same things happen inside the artery. So I'm going to send messages to stop the bleeding. So I'm going to start clotting, which doesn't sound like a great idea inside the arteries, but we need to repair the tissue. I'm going to have white blood cells, which are called other cells inside the artery, that munch some of the debris in there. It becomes sticky, things can start to stick. And then I'm going to manufacture new cells to fill and heal that damage. And I may form a scar, which is basically called plaque inside the artery. So we start to have plaque laying down inside the arteries, which is part of heart disease, where plaque gets built up in the artery and can occlude the vessel. And when we occlude a vessel that is feeding the heart, that's not such a great thing because we need to get blood and oxygen to the heart. So having high insulin in the bloodstream can start to damage the arteries. It can also, of course, when insulin and blood sugar are up, it can also is a precursor to diabetes type 2. Eventually, in type 2 diabetes, the blood sugar after we eat carbohydrates goes up, of course, like for everyone, and insulin goes up. But if we continue this whole scenario of eating carbohydrates more than we can use at every meal and insulin goes up, after a period of time, the insulin can't keep up with the blood sugar. It just continues to go higher and higher. So we can develop type 2 diabetes. So having insulin floating around in the blood is not so good for weight loss, number one. Number two, heart disease. We can start to damage the inside of the arteries. Type 2 diabetes. Also, insulin interferes with hormones. So insulin interferes with the action of the thyroid hormone. It interferes with the sex hormones, estrogen, progesterone, testosterone. In fact, I have patients that come in that, for example, want to get rid of their acne, or they have polycystic ovary syndrome, or they have some hormone imbalance. And after changing their diet and getting their insulin down, their hormones can change. Their testosterone can drop if it was too high, or it can rebalance the hormones. It can also make the thyroid work more efficiently, because when insulin is high, it interferes with the action of the thyroid hormone. So the thyroid, of course, sits here, and it's pumping out thyroid hormone to do what the thyroid hormone does, to regulate metabolism and other things. And so if insulin's floating around, it actually gets in the way of the thyroid hormone working well. And so when insulin comes down after we change our diet, the thyroid actually can work more efficiently. It doesn't have to work as hard. So the thyroid can actually work more efficiently, and metabolism can change.